Thank you very much, Dr. Tan. I'll just wait till the slides get going. All right, again, I'd like to thank the organisers and the committee of the Malaysian Healthy Ageing Society for offering this position and this opportunity to talk about what we've seen come through in healthcare, particularly in the ageing sector. So a couple of slides I've shown yesterday, but I'd like to reiterate the importance. I'm an Australian, I'm a little taller. So I'd like to talk a couple of slides through, we're not showing them though. Sorry team, if I can show the slides on the screen. Just a slight technical issue here. Sorry, I'm just waiting for the slides to change. Otherwise, I will be required to dance, and my team have asked me not to. Oh, there we go. Yep. Perfect. Thank you so much. So I showed this slide yesterday, but I think it's worth reiterating just the importance of what the demographics is going to do to our aged care sector and the serious issues that we're going to face if we don't face them now. So this slide I showed yesterday, 1911 in the top left-hand quadrant was the population in Australia in 1911. Segue down, the population in 1961, we had what we call the baby boomers. If you go up to 2000 in the top right-hand corner, you'll see that the baby boomers are now starting to come through into our older section of our community. And it's going to increase. By the time we get to 2050, you'll see that we're going to have more people in the aged care or the older region of our demographics than we will have in our junior divisions. When I started to look at how to present this data and I started to look at the life expectancy in Malaysia, I found some data that says currently it's 75. What was extraordinary to me is the increase from 50 years since the 1960s. So you have increased your life expectancy in Malaysia by an extraordinary amount. And there's no doubt that with your advances that are currently happening in Malaysia's healthcare system, you are pushing your life expectancy to similar levels to us in Australia. So to my mind, the reason that I was really keen to come here today and this week to really learn what Malaysia is doing so that we can have a lessons learnt between Australia and Malaysia is we are both heading in the same direction. So we're starting to pivot in Australia. We're starting to move from people having a lifespan to a health span. And it's critical that health span increases so that we spend less time infirmed. And we're going to start to focus on the 4 Ps. We need to be proactive, we need to be predictive, and I mentioned predictive yesterday, and I think we've just heard RPM today in the previous talk. We need to talk about prevention. And the last one, and I mentioned this yesterday again, and I think it's key to what we do, is personalisation. So this means we need to start to think about highly targeted support and tailored lifestyle services and advice. It's no longer one size fits all. So when I started to look at, and we've been doing a lot of work in the Centre of Excellence in Health in Australia at Austrade, we started to look at the mega trends that are occurring worldwide and how they're going to have an impact, not just for Australian, but in our community globally. Demography, I've just discussed a little bit about. We've got some policy approaches that really need to underpin and reflect the demography changes that are occurring. We've got Aged Care 4.0, and I'm going to unpack that in a few slides' time. We need to start designing thinking around the built environment. What we've currently got is no longer fit for purpose as we increase our older population. And we need to really start thinking about reshaping our aged care delivery because at the moment it's not sustainable. And I'm going to challenge those who are researchers. We need to start thinking about healthcare in a reimagined way, where we start to look at the older person and how we can research their benefits, not just their physiology or their mental health or their cognitive health, but actually their benefit to society. And we need to look at the elderhood phenomenon, so recasting the world of work. All right, let's unpack them a little bit. There we go. Again, I showed this yesterday, but let me just reiterate. Globally, the demographics are changing, and it's not just Australia and it's not just Malaysia. This is the World Health Organization, where they've said between 2000 and 2050, the number of people aged 60 and over is expected to double. In 2050, and it doesn't seem that long to go, more than 1 in 5 people will be 60 years or older. And I think what's really interesting, and this needs to be in our thinking, is that by 2050, 80% of older people will be living in lower and middle income societies and countries. Therefore, our solutions need to be sustainable from an economic sense. And I keep talking about the individual, but every older person is different. Their medical requirements are going to be different going into the future. So some, like my Pilates teacher who taught me when she was 82 years of age and had flexibility like I've never seen, she was equivalent of a 30-year-old, she didn't need any help. And then there are other similar 82-year-olds who need help from a day-to-day task and quality of life living day. So it's really critical that we don't do a one-size-fits-all and we look at the individual. Policy changes are happening. There is no doubt we've seen in Australia that the government at all levels, from state, federal and community levels, are starting to look at how to embed changes in policy to aid the older person as they go through their health span. Because if you look at the number of people going into that plus 60-year age gap, our current glide path is economically unsustainable. And so we need to find smarter solutions. And I think a lot of our politicians are probably my age, looking down the barrel and thinking, what do we want to be like when we get to that age, and what support do we want? I'll go through this again in a minute, but I mentioned yesterday the voice of the customer is starting to become quite loud, and it's starting to have an impact on what healthcare is going to look like for the older person. And there's no doubt when I've started to look around that Malaysia's public policy is closely following, if not better than, the same path we are in Australia. I showed this yesterday, but it's just to reiterate that our costs related to an ageing population are skyrocketing, and we need to rethink it and we need to reimagine it. When we're young, all of our government costs go to education, and then it tapers off for a long time until we hit about 65 years of age. And then we get 3 things that really do take up a lot of the economic costs of our government spending. One is just basic health, ensuring that older people have access to health to maintain and prevent, where we can, those conditions, or just the impact of normal ageing. We also have an age pension that makes sure that people are able, if they haven't had enough money throughout their career to save up for their ageing lifespan, that they are able to live in a house with food and the other essentials of daily living. And our largest cost is our aged care sector. And that's because we probably haven't got our aged care sector right. And we're thinking very high-end, high energy, high skills required, not high skills, but high number of people required for care. If we continue on this with the doubling of our aged care sector, we're going to be in trouble. And as I look around the room, and I've been around Malaysia in the last few days, it is clear that we are starting to get an older population, like myself, coming through, who are not going to be happy with the things that my grandparents would have been happy with. They would never have challenged the fact that they were putting into an aged care centre. They would never have challenged the fact that a doctor might have told them something that they weren't quite sure about, but they accepted it. They never travelled, my grandparents never travelled internationally, so didn't see what greatness might have looked like in another country and brought that back and wanted to emulate that. And they really weren't self-managers. So I think there is no doubt in my mind that we're seeing, and there's no doubt that aged care industry is seeing a niche by which there is a market for really smart, sophisticated solutions to ageing that our new population, as we come through from 50 to 60 to 70, are going to take up, and we're going to be willing to pay for it. Let's talk about the biggest disruptor, but also the biggest enabler during COVID, is aged care 4.0. We've had the Industrial Revolution, the Industry 4.0. Well, it might have occurred quicker because of COVID, but aged care 4.0 is always going to happen. Now, there's been several converging aspects, and which was wonderful, just heard about RPM. here in Malaysia, and it's something that's, I'm not convinced that it's going to go away. In fact, I think it's going to strengthen that remote patient monitoring leading into a therapeutic outcome. So we're starting to look at in-home aged care enabled by Industry 4.0 with digital health, AI, robotics and the Internet of Things. We're going to respond to consumer demand away from residential care and residential models. People want to stay in their home for longer independently. So we need to look into the future and what does a smarter and safer home look like? I was a bit scared by this slide when I found it. One of my younger staff put this in and I thought, I'm pretty sure I'm still in the third wave. But there's no doubt we've got digital waves coming through and they are impacting how we are looking at all aspects of life, but particularly in that aged care sector. In 2000s, we had 1 billion internet users, but we're all in our rooms connected by wire into our internet. Move into 2010 and we have 10 billion devices and we're going anywhere with our mobile devices with real-time monitoring, service anywhere, we can have information coaching. Now I thought this is where we were now in the third wave, but I think it shows my age. We're now talking about the Internet of Things. So we've got the physical and digital convergence happening and we've got consumer control. I was out at lunch with a friend the other day and her doorbell rang. We were at least 10 kilometres away and she was able to communicate with the person at the door to leave the parcel because the postman had delivered a parcel. The next one is by 2020, which we passed, is the 50 billion devices, and we're now talking AI, artificial intelligence and robotics, where we're going to have knowledge access, we're going to have human emotion focus, so it's not just about data, but how the humans interact with that data and that robotics, and we're going to have machine-man collaboration in care. And I think we just heard a little bit about that with the RPM program here in Malaysia. Let me take you through one of the things that I've always been really interested in, and that is walking and hip fractures. There is no doubt it's the second biggest mortality rate is caused by falls, and after 5 years after a fall, your risk of mortality is greatly increased. So keeping people on their feet without having a fall is central to try and reduce our medical burden. And we've got some really cheap sensors that we can start to implement into shoes of our older persons so that as they're walking, we can determine their gait. I've got my watch here. It doesn't just tell me my heart rate. It can tell me how many steps I've made. It can call me and tell me that my family want to know what's for dinner. They literally did that 30 minutes ago. So, you know, I can get a whole host of things by planting or putting in sensors into certain aspects of my clothing that will then be able to go back to a medical centre to say, you are fine, you are fine. Once you might get to a point, and we get here where we've got the automated checkup, where your gait or your speed has gone below a level that we would expect from you, and we need to get an intervention. And that might not be a doctor's intervention, it might be that we need a physio, an occupational therapist, or someone else to intervene in that. And hopefully by intervening quickly and early, as we just heard with the RPM program, we then get back up to a level where we continue on our daily living tasks. The risk of not doing that is we get down into that high cost and our risk of a fall, and then mortality after that increases. This is a proposal by Haley Assist, who are doing this now, and they're putting in smart sensors, and there's 5 of them, into residential care, which is all about real-time monitoring. And so it's an artificial behavioural monitoring device where we've got a central hub, we've got speakers, we've got latch sensors, motion sensors and night lights. And by ensuring that all of these are working and integrating, we can get, for example, an indication that a resident of that room has fallen out of their bed, for example, or that they haven't opened the fridge for the last 2 days and therefore their nutrition is likely to be poor. You know, they might not have settled into bed for the night and they're still wandering around, you know, particularly with our dementia patients, we know that's an issue. They might not have moved for 24 hours and therefore they might have had some cardiac event. Or, like my mother, who occasionally rings me at night and goes, I'm feeling pretty dizzy, and I go, did you take medication today? Oh, no. So, you know, that trigger that which is now on her phone that she got yesterday, you know, that trigger, that alarm that says your medication is due. These are the types of smart things that we can start to put in these smart homes. And then, of course, there's the longer term care, which is about, you know, how do we work with these sensors to actually improve dementia management, which can, for our aged care staff, be really draining if you don't get it right. Depression management as well, and then of course infection minimisation. This is all about co-design and co-living, so it's a lovely indication of where the future is going to be, and it's going to come sooner rather than later. As I said, we're starting to rethink what residential care looks like for an older person. And we're moving away, and that's why I just love being in Malaysia. I don't think you've ever gone into segregation because you're such a cultural acceptance of older people, but we're moving into integration models where we've got intergenerations living together. I know it sounds strange being Malaysian, but in Australia it's quite abnormal for us to think this way. And we're starting to move into community health hubs, and this is going to be essential if we're going to sustain the cost of our older population. This is just to indicate that the quality of life and the cost of care are disparate. So if you've got a high quality of life, you tend to have a low cost of care, and as you go through and your quality of life decreases, then your cost of care increases. This is what aged care sector looks like for us at the moment. You've got our older people living at home. They either pass through a retirement village if they feel that that's right for them. They might pass away and die in the meantime at home, or they go into some sort of level of care, whether it be a service department or a low level care, and then transmit through to a medium care and then high level of care. What we need to do, and particularly with a number of older people, we need to keep them in this top left-hand quadrant, I'll get it right, so for longer, so that they don't transmit or transfer into that residential care model until the very end of their life when they need palliative care. So how do we do this? And I know our last speaker was talking about our consumer-directed care. So it means that we're now starting to look at that smart model where we implement these sensors into a person's home and have these community hubs, so that one practitioner, one health practitioner, whether it be a medical doctor, a health nurse, an allied practitioner, can actually monitor a whole number of residents living independently without having a nurse come through all the time to check on them. So the costs for that are much lower. And we use our Internet of Things and our data management and our AI to ensure that we are able to support a lot more people living independently. This is an indication of what a future hub will look like. It looks cute. I'd like to live there. It looks interesting. It's going to have cafes. It's going to have the theatres. It's going to have the things that we culturally would like to have because that's what we've had our whole adult life. But it's going to enable us to live there longer, even if we might have some cognitive issues or some musculoskeletal issues, because we've got the sensors enabling us and monitoring us as an individual, not collectively. Because my walking speed might be quite fast compared to someone else. So if I slowed down, my walking speed's still normal for other people, but slow for me. So it's about individualism. I found this in the newspaper last week and I jumped for joy. So we now have aged care centres, residential centres that have childcare centres opening up next door. And I know for you, you probably go, why is that so interesting? It's a profound change for us in how we're starting to think about intergenerational relationships. And it was really interesting. There's a lovely quote in the newspaper by Emeritus Professor Annika Fitzgerald, who did the research about this intergenerational co-location. And she said, a monthly morning tea is not intergenerational practice. It's a visit. What we're talking about is something that's planned, curriculum-based, and has a reciprocal benefit. I just think this is where we need to look at, So that it's not just about an older person and a younger person together having a visit, having a cup of tea and a laugh and walking away, but it's implanting the pedagogical practices that we would into childcare and the aspects that could bring that older person's knowledge and skills into that childcare centre, and that community grows, and the benefit for both is enormous. Here's our big challenge. In Australia, we are in trouble with our aged care sector workforce, there's no doubt. So it's rapidly expanding. Obviously, our demographics in that older population are expanding. So we need 17,000 direct aged care workers each year until at least 2030. That's if we don't reimagine what aged care can look like. So obviously we've got to think about wages and conditions. We've got to really think about our training outcomes and investment in ongoing development. We need solutions through technology, and I think that's where we need to start, is how do we embed technology that makes it easier and more pleasant for our aged care workforce to work. And we need that knowledge sharing. The other thing is we've got to keep our really skilled workforce in aged care. Geriatric care is niche. It's not, you can't just walk in from a nursing environment, I don't think, and walk into aged care. The same with my chiropractic students. Getting them into that aged care centre and giving them that skills and that technique are essential for them going forward. Don't worry about the rest of this graph, but if you can see the very first one, that is currently our unemployed looking for a full-time or part-time job in a specific industry, and that's their healthcare and social assistance one. There are double the number of job vacancies. So if you want to work in aged care and healthcare, there's a job for you. But we really need to look at it because it is draining, and there's no doubt that COVID has been really draining on our allied health and health staff. And this is my new mantra. Obviously, I'm getting into that older phase of my life and harnessing the elderhood phenomenon. It's an absolute win-win. So we need, and again, I look at the Malaysian culture that respects, harnesses the benefit of the older person and really celebrates that. And we have a lot to do to adopt and adapt that to our way of thinking. But we need to look at the older person and how they can bring their skills and their knowledge continually into workplaces, and not say by the age of 60, 65 or 68, you're past your due time, go out and do something else. There's no doubt that our life phases are changing, and I'll challenge all of us in this room to look at this and not say that the 2034 model is something that we want to be, where we're not about the child, adult and old that would have been in 1934. We're now the child, we go through adolescence, we go through adulthood, then elderhood, and then we have a small phase of completion of our lifespan. I think that's where we need to get to, and we've got to get to it to be economically sustainable. Showed this slide yesterday, but I want to start to finish my presentation today on this. We are heading into a point in our health system where we're going to go from treating the patient illness to managing consumer health and wellbeing. We're going to go away from accepting a one-size-fits-all to precision health solutions that are really critical to the individual. We're going to go away from that reactive health system to a holistic, predictive outcome that's based on that Internet of Things and that data collection on the person. And we're going to go from extending life to improving the quality of life over a lifetime. These are just some of the exemplars of our health companies in healthy ageing, and I would really recommend, if there's any there, please let us know. It's a mix of both our education, our medtech, our biotech, and some of those that you wouldn't necessarily think about being in aged care. As I said, our great Australian companies are starting to look at aged care as where they can get to and be impactful. And if nothing else, COVID has really highlighted to a lot of our Australian companies the benefit of being impactful and having society and community benefit. So please, if there's any there that you would like to know more about, please let us know. I finished yesterday with a photo of my biological family, but I wouldn't be standing here without two beautiful people in this room. So Melanie and Sandra, wave. So in Austrade, we call ourselves a family, and there's no doubt that these two beautiful people supported my application to come today. So I'm from Melbourne, Australia, arrived on the weekend. And it's the benefit of being here that is critical to us having that knowledge to share. So any of the companies that I've shown, both Sandra and Melanie, will be able to take you through, and they are your point of contact. They both live in Kuala Lumpur. Melanie is from Australia, but she's now resident here, so feel free to reach out to them. Can I just again thank you for your time. Thank you for the invitation. It's been absolutely lovely to share my journey with you today.
Still can't hear? Can you hear me now? Yay, fantastic. Okay, questions? Okay, I'm going to ask some then. Okay, thank you so much. And whatever you said is so close to my heart, because as a geriatrician, discharging patients is a nightmare from a geriatric ward. Because you have this whole army of doctors that says to the patient's relative, they don't even talk to the patient. Why talk to the patient? They're old. They must be stupid. So they either consider them uneducated or demented. That's all they think about. Sorry, I don't usually use the word demented, but that's what they think. Yeah. They say to the older person, to the patient's relative, don't ever leave them on their own. Now that whatever you showed just really tell us that is no longer feasible in this day and age, isn't it? Yeah.
Absolutely. Well, it's not sustainable.
It's not sustainable.
And, you know, I'm not sure. I think even with a person who is living with dementia, a bit of quiet time is actually not a bad thing.
They drive them crazy.
You know, but I've experienced the same in my personal life, and that is my passion project now, to ensure that the older person has dignity. And that's why I looked to the Malaysian culture, because you really do beautifully look at your older person with dignity. And I think we've got a lot to learn. But I agree with you. So many times doctors have said, so your mother, and I'm like, she's here. She's cognitively fine, just talk to her. So it is about rethinking. We've got that skilling to do, but we need to do it again with our digital thought process about what technology can do.
And you shared with us beautifully about what's available. But I think part of the barrier is how to get people to access what's available. And again, we have this issue. You talk to this older person. You live on your own, and you're a bit worried about going home. So I've got these people, a group of people you want to meet, and they would be able to help you identify what you might need in order to manage at home the way you are. And then you can gradually get better, and you can get rid of them later. And then he'll say, oh, talk to my son. Yeah. Does that happen in Australia as well?
Oh, of course it does. Absolutely. So I think one of the things that we've got to be really cognizant of is the Internet of Things. As I mentioned yesterday, you know, we've got older people, and I'll do the iPhone analogy just because it's close to my heart at the moment, where my mother's got the iPhone 5 and she's just been given the iPhone 11 and didn't go through that process of each of the iPhones, and the apps have changed, and she's now got this brand new phone that's a bit of a brick at the moment because she doesn't know how to use it. So what we need to do is insert very slowly, or make the devices and the sensors remote so they don't need human interventions. The older person doesn't have to know what that sensor is doing, just that it's doing something, and when something beeps, that beep means you've missed your medication, and that beep means you need to call your doctor, or your doctor's going to call you, and don't be shocked. But it's got to be ubiquitous. It can't be something that this older person needs to go, I've got to worry about that, and then I've got to worry about that, and oh, I forgot to do that because that sensor's telling me. You know, it's got to be very plain. And we've got, sorry, I'm going to say this, we've got to upskill our medical practitioners, our allied health practitioners, that this is what it means. When this person go home, don't stress them, it's just going to work.
Yeah, I think you need to give them the confidence. Give them the confidence that you believe they're going to be able to manage at home. And in fact, the default position is to assume they are going to manage at home until proven otherwise, and not to put them in the care home just in case. In fact, nobody puts an older person in the care home, is that right?
Oh, Well, I won't answer that because I think I'm being recorded.
Okay, right. I've got a question from an audience. A role of smart device and cloud computing. I presume you need a smart device to put all those things together. And whose smart device does it connect to?
Ah, correct. Okay, so at the moment it would be the company. So that's why our companies, our good Australian companies, are really looking at this as a way of actually getting a profit, but also, you know, doing good. So yeah, it would be the private company with private health insurance in Australia who would pay for that. But what you will see is as our prices start to come down, because it's becoming a more accepted and ubiquitous technology, is we'll probably see a lot of our government looking at that going, actually we'll fund that, because it's cheaper for us to fund that than to have the people go to hospital, you know, because we haven't done that preventative measure.
Yeah, and it overcomes a lot of the issues we currently have with labour shortage. We have the same issue in Malaysia. You've never thought about that, would we? Yeah, but we've always depended heavily on foreign labour to care for our older adults. I like to think about taking over all the roles of an older adult, and then and now we no longer have it because of COVID. Yeah, and when we restart, we don't think they're coming back. Yeah. So, one of the things about Malaysia, especially in the beautiful island of Penang, is we actually have a really good semiconductor industry. So sensors will be our strength.
We love that. We love the semiconductors. But again, you know, there's been quite an issue with semiconductors during COVID, so...
Yeah. Okay. So, any more questions? No? Speak now or forever hold your peace. Okay, in which case, let's thank Professor Regina in the usual way.
Thank you so much.
Thank you so much.